Thank you. Usually when we're talking about head and neck cancer, we're talking about it with the same set of risk factors that we think about for lung cancer. So alcohol and tobacco consumption. And we've made great strides in the United States in terms of the percentage of people who use tobacco. And so for many of those cancers, the rates are going down. Interestingly, we saw one area of the head and neck where we're seeing a distinct difference in the rates. They're going up quite dramatically, and it seems to be related to HPV. So the first evidence for this was in about 1995, and a group at Johns Hopkins looked at all of the cancers they had archived, and they looked by doing some special staining tests in the Department of Pathology for cancers that had the HPV virus, and they found that a quarter of all of the head and neck cancers did. When they looked at the specific areas of the head and neck, so specifically the oropharynx, which is the tonsils and the back of the tongue where you can't really see, it was 90%, and most of these were positive with type 16. These were patients who had not had a long history of smoking, had not had a long history of heavy alcohol use. They were younger, and again, primarily located in the tonsil and what we call the base of the tongue. So again, we see rather distinct differences in the rates. And so if you look at HPV-related cancers in men, their trend is going up. HPV unrelated, so cancers traditionally associated with alcohol and tobacco, are going down as people are realizing that tobacco is very harmful for the health. HPV-related cancers in women in the head and neck are reasonably flat. They're going up a little bit, but not much. And HPV-unrelated in women also are going down as both men and women are decreasing their rates of smoking. So it's not clear why this is a disease that's affecting young men, because these would be people who were infected before vaccines were ever introduced. So there's some kind of a biological difference between what this virus does in men and women in the oropharynx. So again, just another graphic showing the projected trajectory of this. And if you look at oropharyngeal cancer, so tonsil base of tongue, you can see this sharp rise here. This pointer's a little sick. And cervical cancer, the rates are going down with screening and vaccination practices. This is oropharynx in women, going up just a little bit. And so all the other areas of the head and neck, the tongue, the voice box, going down, those are associated with smoking. And then you see this sharp curve up here, which is the oropharynx. So a very specific area of the head and neck, and often an area that's kind of difficult to see. So just another graphic. This was a paper that was looking at different ways of detecting it. And it doesn't matter how you look for it. The percentage of cancers of this area that are positive for the papillomavirus is now as high as 80–90% in many studies. Whereas even just 20 years ago, it was much less, at 50% or so. So unfortunately, there isn't a screening test. We don't have the PAP equivalent in the head and neck. You can certainly do a swab of the throat, but it's never been shown to be of any value. So we don't have a screening practice to look for these things before they turn into cancers. And for that reason, there isn't really an equivalent of a precancerous lesion in the head and neck. It's kind of an all or nothing phenomena. Unfortunately, these patients usually then present with a neck mass, a lymph node where it's metastasized to a lymph node, because the symptoms in the throat are so vague. I mean, we all have a cold and we get that kind of weird sensation of sore throat or something stuck in your throat. That could be the same thing. Fortunately, the vast majority of the time it's not, but that could be the same thing that one would have with a head and neck cancer. And so they go on with vague-like symptoms often for quite some time, and I think the example of Michael Douglas is a good one. I mean, he certainly had other risk factors. He had a long tobacco history, but he presented to many doctors before he was ultimately diagnosed, well-intentioned people looking to find this, but couldn't really see anything. And I think ultimately he developed a neck mass that was discovered. Again, the throat symptoms are usually pretty vague. It's not that you're in severe pain or you suddenly can't swallow your orange juice. It's just a a vague sort of discomfort or a slight change or nothing. And the treatment for this is usually some combination of surgery and radiation, and it's a hard treatment. This might be what you could see looking in the mouth. This would be a tumor on the tonsil. This would be one that would be pretty easy to notice. If it's on the back of the tongue, though, very, very difficult to see. You need a mirror or a scope to look around the corner of the tongue to get any sense of what's there. We've got Ebert here, who actually had thyroid cancer, but just to give a sense of how significant the treatments can be for these things, they can be quite disfiguring. And so prevention, an ounce of prevention is worth many surgeries of cure. So where does this occur? I mentioned it's in the tonsils and the base of the tongue. It's not in really the mouth. So often it's in the media, it's oral cavity cancer, or the oral cavity is the mouth. It's really not in the mouth, it's beyond the mouth in the back of the throat. So this is just some normal appearing tonsils that are different sizes, but this would be one location, the tonsils, and the other location is the back of the tongue. So this is the way we often look at these areas, using a little camera through the nose. So this is somebody's vocal cords here. This is the epiglottis, that little flap of tissue that moves down to protect our airway when we swallow. And it's just in front of that epiglottis where the base of the tongue is. So it's a tricky area to see without some extra equipment. And this is often the lymph node right here that gets big. It's the same lymph node that you feel in your neck when you get a cold that gets big. That's usually the lymph node that becomes involved with these cancers. In most patients, that's how they present. They've got a neck mass that doesn't hurt, that just hasn't gone away. They're not sick, and they say, what is this? And ultimately, it leads down the path to finding the HPV-related cancer. So again, this is disproportionately affecting males by a significant degree. Males clear the virus more slowly. We don't know why. 90% of people are going to have the virus cleared by 2 years, 2/3 by a year, and men just do not clear it as well. The estimation was that oropharyngeal cancer would pass cervical cancer in 2020. You saw the numbers that Sarah showed in Wisconsin. That has probably already happened. And we don't see a break in this curve because it's going to take aggressive vaccination now to cause a break in this curve 20 to 30 years from now. So we really have to be kind of forward thinking. And the majority of these, again, are caused by type 16, and the virus type 16 is included in all of the approved vaccines for males and females. So how common is the virus? Obviously, if it's causing a cancer in the head and neck, there's an infection in the head and neck. Well, there was an interesting study that was done where swabs were sent out to a large swath of the population, thousands of people. And what they found was that 7% of the population tested, ages 14 to 69, were infected with some strain of HPV. And it was higher in men than women, again, speaking to this difference in the way men and women clear the virus. There were a couple of peaks in men in the 30s and again in the 60s. And when you look at the virus that causes the cancer, the overall rate of infection was about 1%. That's a lot of people. Fortunately, the vast majority of those people, again, are going to clear the infection. But when you're talking about a population of 300 million, 1% of 300 million is not a trivial number. The question often comes up about oral-to-oral transmission. Is this something that one could pass on by sharing a glass of water, by sharing a toothbrush? The answer is probably not. It seems to be different sexual behaviors, but not kissing and things like that transmit this virus. I'm going to pass it on to, back to you, Sarah, okay.